The resurgence of measles in the United States is a stark reminder of the fragility of public health and the dangers of vaccine hesitancy. What began as an outbreak in West Texas and New Mexico has metastasized, spreading its contagious tendrils across the nation, impacting states as diverse as Pennsylvania, California, and Oklahoma. The grim reality of this resurgence is underscored by the fact that 2025 has already witnessed over 250 confirmed cases, tragically resulting in 2 deaths, one of which involved an unvaccinated child, marking the first measles-related fatality in the U.S. in a decade. This chilling statistic casts a long shadow over the nation's collective health security. This alarming outbreak arrives amidst a backdrop of rising vaccine skepticism, fueled in no small part by prominent figures who continue to propagate misinformation. Robert F. Kennedy Jr., a high-profile individual, has publicly cast doubt on the safety of the measles, mumps, and rubella (MMR) vaccine, making unsubstantiated claims about its purported link to illnesses typically associated with measles itself. These pronouncements, disseminated through major news outlets like Fox News, directly contradict decades of rigorous scientific research, demonstrating that the side effects of the MMR vaccine are overwhelmingly less severe than the potentially life-threatening consequences of contracting the measles virus. The severity of the situation cannot be overstated. Measles is one of the most highly contagious diseases known to humankind, capable of causing a spectrum of debilitating complications, some of which can prove fatal. The Centers for Disease Control and Prevention, CDC, unequivocally emphasizes that the most effective safeguard against this devastating illness is vaccination. The MMR vaccine boasts a remarkable 97% effectiveness rate when administered in 2 doses, providing lifelong protection for the vast majority of recipients. Even a single dose provides approximately 93% protection, significantly reducing the risk of infection. The CDC's recommendations extend beyond individual protection to encompass community immunity. When vaccination rates exceed 95% within a population, the concept of herd immunity comes into play, shielding even unvaccinated individuals from the disease's spread. This collective protection is crucial, especially for vulnerable individuals who may not be able to receive the vaccine due to medical reasons. The magnitude of the current outbreak is deeply concerning. Texas alone has reported a staggering 223 cases since late January, leading to 29 hospitalizations. Alarmingly, over half of these cases involve children under the age of 17, highlighting the urgent need for increased vaccination efforts among younger populations. The geographical spread of the disease is equally troubling. As of March 6, 2025, measles cases have been confirmed in a multitude of states, including California, Alaska, Florida, Georgia, Kentucky, New Jersey, New Mexico, New York City, Pennsylvania, Rhode Island, and Washington. A disheartening majority of these cases have occurred in unvaccinated individuals. The recent confirmation of measles cases in Oklahoma and Vermont marks a significant escalation of the outbreak. Oklahoma's health department reported 2 confirmed cases, while Vermont officials confirmed an infection in a school-aged child, raising concerns about potential spread within educational settings. California has also witnessed a concerning rise in cases, with confirmed infections reported in Los Angeles and Fresno counties. New Mexico, already grappling with a declared outbreak, has seen its case count climb to 33, with a new case reported in Eddy County, the first outside of Lee County, signaling further expansion. The CDC's prediction of further increases in measles cases is a sobering reality. The rapid spread of the virus necessitates immediate and decisive action. Measles was officially declared eliminated from the U.S. in 2000, a status that signified the virus was no longer continuously circulating within the country. This hard-earned achievement is now severely threatened. The recent withdrawal of Dave Weldon's nomination to lead the CDC further highlights the complex political and social landscape surrounding vaccine policy. Weldon, a former Republican congressman and doctor who has publicly questioned vaccine safety, was Donald Trump's nominee for the position. However, His nomination was withdrawn by the White House just hours before his scheduled Senate confirmation hearing. This decision underscores the intense scrutiny surrounding appointments to key public health roles and the crucial importance of evidence-based decision-making in guiding public health policy. The current measles outbreak serves as a potent reminder of the vital role vaccines play in protecting public health. Combating this resurgence requires a multi-pronged approach: increased vaccination efforts, targeted public health campaigns to address vaccine hesitancy, and a renewed commitment to evidence-based public health policies. The stakes are high, and the consequences of inaction are potentially catastrophic. The time for decisive action is now. The future health of the nation depends on it. The lives of countless children and vulnerable individuals hang in the balance. The responsibility to act rests squarely on the shoulders of individuals, communities, and policymakers alike. We must reclaim the hard-won victory against measles and prevent this preventable disease from wreaking further havoc on the nation's health. This is not merely a public health crisis. It is a societal challenge demanding immediate attention and collective action. The future health and well-being of generations to come depend on our response to this urgent situation. The time to act is now, before the virus claims more lives and further undermines public health infrastructure. Let us unite to combat this resurgence and reaffirm our commitment to a healthier future for all.